You're on mute.
Sorry. Hi, everyone. Welcome to the third session that we're hosting. This is a session that will be on the topic of unlocking the power of advanced technology and smart synergy. The synergy that we're talking about is between two of the solutions that we work with, but also to give you an understanding of how you can find synergies between different technologies and how they could be used as a combined solution for an operational need in the Australian aged care or healthcare sector. So with that, I'll hand it over to April, who will be speaking to you for the rest of the episode. As usual, at the end of the session, we will have a bit of a Q&A. You can answer this through the Q&A by using your computer. It's on the top toolbar. If you're on your phone, you can go to more info with iPhone or Android. More options. You can select the three dots, open it up, type in your Q&A there, and we'll address all of it at the end of this session. Go ahead, April.
All right, thank you, Sharithan. So hello, everyone, and welcome to the third session of Omni-Health Online Demo. And I'm excited to have you with us today as we unlock the power of advanced technology through smart synergy with Nobi Smart Lights and Temi Robot. Before we begin, let me ask you this simple question. What if technology can not only detect incidents, but also respond instantly to make a care safer and smarter? That's exactly why we're here. We'll explore today how Nobi and Temi together transform fall detection, prevention, and incident management into a seamless, intelligent solution. And let's unlock this together, the power of smart synergy in care. To begin, let's take a closer look at the challenges carers face every single day. First, undetected falls. A fall that goes unnoticed for even a few minutes can become life-threatening. Then we have staff shortages. One carer simply can't be everywhere at once. How many of you here feel short staff in most shifts? Delayed incident response means greater health risks and unfortunately higher liability for facilities. And of course, there's burnout and stress. Staff are pulled between routine tasks and sudden emergencies. Does this sound familiar to anyone here? And finally, communication gaps. Important details about incidents don't always get shared quickly, which slows down response. Given all these challenges, what if technology could actually make care safer and smarter, not harder for the facilities? Let's now start with Nobi Smart Lights. Imagine this scenario. In the middle of the night, a resident rises to get up, and unfortunately, they fall. Normally, this might go unnoticed for minutes or even hours, but with Nobi, the fall is detected instantly and an alert is sent right away. Question for you, how much peace of mind would that give your care team knowing they'll be notified immediately? Nobi doesn't just detect falls, it prevents them too. With intelligent lighting that switches on at night, residents are less likely to stumble in the dark. And because Nobi works quietly in the background, carers can monitor residents unobtrusively while still maintaining dignity and independence. And as a result, a safer environment with 24/7 protection. And now let's talk about Temi, the personal assistive robot. The moment Nobi detects a fall, Temi springs into action. It can move directly to the resident's location and a smart real-time video call with carers or family members. Imagine this. Instead of rushing across the facility blindly, carers already know what's happening and where. Temi also helps with the day-to-day care, reminding residents of medications, guiding them through the building, or even providing friendly check-ins. By automating this task, staff can focus more on personal, human-centered care. And what's the outcome? Faster responses, less workload, and more reassurance for everyone involved. We have prepared a short video demo. Please watch this.
Meet Nobi, designed for fall prevention, detection and happy living. A lamp powered by advanced artificial intelligence. Nobi works well at home, in hospitals and has been installed successfully in care homes. We have a sample resident in our demo room, where Nobi has been used in the demo room. The resident suddenly fell in the bed. A fall alert has sent to the dashboards, as well in the Nobi mobile app to alert carers. Nobi also sends alerts to Temi as first responder. This is when carers or family members can do a video call and check on the resident. It can also be integrated with smart devices, enables Nobi to collect data in one health profile. As the world's population ages, Nobi is not only a partner for the elderly, but also for the care professionals. Nobi supports even the busiest carers to manage an individual, personalized care approach. Nobi also takes care of repeated monitoring tasks, so carers can continue to focus on warm, meaningful interactions that make a real difference in the life and happiness of the elderly. And that is Nobi, safe and happy living.
See where the magic happens, where smart synergy. Nobi detects the fall, Temi responds instantly, staff are notified in real time. The incident is managed smoothly and everything is documented. Together, they close the gap between detection and response. Would you agree this kind of teamwork between technologies could transform how we approach aged care and healthcare? In short, safer residents, empowered staff, and peace of mind for the families. Now let me walk through how Nobi keeps residents safe. First, Nobi uses a fisheye optical sensor with infrared LEDs, giving a full room view that's up to 10 meters for Nobi and 5 meters for Nobita. Here's a quick thought too. How often do you think falls happen just for a carrier's line of sight? With Nobi's help, the blind spot disappears. What makes Nobi so accurate? It can actually recognize unusual body positions using 18 reference points on the human body. So whether someone stumbles, sits awkwardly, or collapses, Nobi knows the difference. Now, there's something families really care about: privacy. All image analysis happens inside the lamp itself on an NVIDIA Jetson processor. That means no images ever leave the device. It uses tensor RT and custom detection models to evaluate posture, position, and even the bed layout. So residents get safety without compromising dignity. But Nobi doesn't stop to fall detection. It also a smart environment sensor. It adjusts circadian lighting throughout the day, supporting healthier sleep patterns. It even tracks in-bed and out-of-bed movements to generate sleep reports, giving early insights into health changes. Imagine this. What if you could spot early warning signs like increased restlessness before they become serious health issues? So with Nobi, it's not just about detecting falls, it's about creating a smarter, safer, and healthier environment every single day. Nobi also comes with a range of peripherals, from buttons to wearables, health devices to smart locks. Each accessory adds another layer of safety, accessibility, and independence to the Nobi ecosystem. Together, they make care smarter, simpler, and more human. Now let's see what happens with Nobi and Temi work together when we call smart synergy. The flow is so simple: detection, response, resolution. Nobi provides continuous monitoring. It instantly detects falls and unusual movements. Then comes Temi for the immediate response. It moves straight to the resident, connects them in video or via video to carers or family members, and ensures help is on the way. Together, they reduce carers' workload by automating monitoring and first response. That means staff can focus more on personal, human-centered care. And what's the outcome? Enhanced resident safety and peace of mind for the families. Or, as we like to say, from detection to response, Nobi and Temi deliver smarter, safer care. Quick question. Can you see how this synergy could enhance your current daily workflow? Or would you consider integrating this solution into your existing processes? All right, so now it's time for the Q&A. But first, let me share a few questions that often come up. This might be the same ones you have in mind. Some questions, some of them ask, what are the requirements of putting this technology on site? With Nobi, it's designed to be simple to set up with minimal on-site requirements. It runs on a standard main power supply, so no extra wiring is needed during installation. For connectivity, it uses Wi-Fi to send alerts, provide access to the dashboard, and integrate seamlessly with existing NARS call systems. And its open API, Nobi can easily connect with other smart devices and healthcare platforms, making it high flexible in different care environments. There's another question. How would you compare Nobi to other fall detection systems, and why choose Nobi? Well, Nobi stands out from the traditional fall detection systems and wearable devices for several key reasons. Unlike pendants, it's completely wearable free. Residents don't have to remember to wear it or charge anything, making it effortless and low maintenance. And on privacy, Nobi uses local AI and anonymized stick figures, ensuring no personal image ever leave the device. Its visuals also give carers a quick, clear understanding of what happened. Plus, it works reliably in all conditions, even in a darkness or a theme environment. Where Nobi truly differentiates itself in prevention, beyond detecting falls, it actively helps prevent them through circadian lighting, out of bed alerts, and sleep monitoring that generates personalized health insights. Nobi also supports two-way communication, asking residents directly if they've fallen, and provides 15 seconds of anonymized context before and after each incident, making follow-up analysis far easier than with other systems. Altogether, Nobi combines prevention, detection, communication, and design, creating not just a safety device, but a complete care companion that feels less clinical and more resident friendly. If you have other questions in mind, feel free to ask or email us or give us a call. Or, Shurisan, is there any other questions in mind?
Yeah, so two questions were just SMSed to me. So one of the questions comes from an enrolled nurse in a Victorian aged care residential facility, just for context. Okay, the question is, if the Nobi Smart Light goes offline mid-shift because of a Wi-Fi outage, what is the immediate procedure, and will I need to physically reset or do anything else along with my other duties? Okay, so the question is essentially, I mean, it's a very good question, because any of these technologies, you don't want staff or individuals who have already got a primary care objective to be taking these reactive actions to resolve something else that's basically a new problem that's been caused for them. So that's simple. If there is a Wi-Fi outage, it just means Nobi will continue detecting and doing its job and functioning like a light, but it will not be able to send the alerts, because in order to receive the alerts, the facility needs to have a Wi-Fi, and whatever device you're using needs to be connected to the internet. But the device will still continue to detect, which means if someone gets up in the bed in the middle of the night, the ambient orange light that is much dimmer, that shines towards the ceiling to make sure they're not disoriented, that will still be triggered and will still turn on. It does not need internet to do that, because all the processing is being done on the device itself that's sitting on the ceiling. So that still goes ahead. If someone has a fall, the Nobi light will still detect the fall. It will not be able to send an alert anywhere because there is no Wi-Fi. But it will still detect that incident as happened. So it will still be able to know that someone sat up at this time, someone got out of the bed at this time, someone left the room at this time, someone had a fall at this time. It'll be able to get all that information. The moment the Wi-Fi comes back online, all of that remains in the log and can be viewed from the dashboard. So you don't lose any of that data. So in that sense, you can be assured that if it is an individual who just requires assistance where the ambient light turns on, or when they get out of bed, the full light turns on, all of that will still go ahead when the Wi-Fi goes out. There is no action that is needed to be taken by in this case, an enrolled nurse or any staff member on site. And once the Wi-Fi is back online, all those things that were detected will still be available and visible in the logs, so you wouldn't lose any of that information. The second question that came in was about, again, was from the same EN. How long will it take for a nurse to be trained to operate and troubleshoot the system? And will the training be counted as paid time? Okay, the training being counted as paid time, I'm not in a position to answer. I presume it's going to be yes. That'll be based on wherever the facility that you are working at is. But the first part of the question, how long will it take to be trained? Essentially, what we would do is with the Nobi, you would go through a process of first, we put the Nobi in. It functions like a normal light. You turn it on and off. And you would get all the data that is collected from its sleep reports and its logs to understand how frequently certain activities are happening. There is no need for any staff intervention or reaction at that point. After that is done, we then go through the process of deciding for which rooms, what sort of alerts do you want the staff to receive based on the frequency. Once that is decided, all that is needed to be understood from a staff member is once you receive the alert, it could be on a screen in the common nurse station, could be on a mobile device if the facility staff walk around with devices for communication, Android or iOS device. Whichever way, once you receive that alert in your hand or on the screen, it provides you with all the same sort of information that a nurse call system would provide, in the sense that it will say which room number, it will say what it is that was detected, whether there was a bed exit or a fall, and so you can immediately take action. So the training is very simple. Someone who understands how a modern nurse call system is working, where you receive that bit of information, you attend to the scene, no issues with Nobi. And in this case, what we described was there would be an additional integration in order for Nobi to detect and Temi to react, where you could then say, Nobi detects that information is passed on through this nurse call system process or just through a screen through the nursing staff, to the nursing staff. Temi reacts and addresses the incident immediately. And then the nursing staff or whoever the carer is or whoever is on site can go then as the secondary respondent. So the training will not take long at all. There is no need for ENs and RNs to be trained on setting up the system, reacting to problem solving, all that sort of thing. That's where we will work with them from the initial setup to make sure that all of that is seamless. Those are the two questions that were SMS to me just before this.
All right, thank you, Shuri-san. So again, guys, if you have any other questions in mind or after this session, feel free to email us or give us a call. We'd be happy to discuss how we can provide the best solution for you. But before we end our session, let me also show some of our robotic solutions. So we also have the cleaning robots and our autonomous mobile service robot. All right, so to know more about these solutions, you can contact us. Details are on your screen, so follow us in our Instagram and Facebook. As well, you can check us on the website omnihealth.com and temi.au, and you can check our LinkedIn page. So thank you again, and we look forward to partnering with you on this exciting journey toward smarter care. Have a nice day and have a good week.
Bye, everyone.
Bye.